Hello, everybody. This is Gary. Today is Monday, January 16th, 2023. It is 3:45 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my symptoms are really bad. My anxiety levels are very, very high. I feel very restless and agitated. Um, I did go out today and do my physical therapy exercises and my walking exercises. I did some meditation twice today. Um, I did some work on my computer. I'm making this video as part of my daily schedule, although I haven't been doing a video every day like I wanted to. Um, so my symptoms are pretty bad today. Um, I had to go to the emergency room yesterday because I had food lodged in my esophagus, not to the point where it was blocking my breathing. It was lower down in my sternum. The food wouldn't go down. If I tried to drink water or fluids, they would just come back up again because the food was blocking the passage to my stomach. When I got to the emergency room, eventually it went down on its own. The food, that is, in the emergency room didn't have to do anything. They did have me eat a sandwich and drink some ginger ale to make sure that the food had gone down and my esophagus was clear. If it was still stuck, they would have had to have me seen by the gastroenterologist in the emergency room, and then they would have had to put something down my throat to make the food move. The reason that happens is because I'm on Seroquel, 600 milligrams nightly, and it makes it difficult to swallow food sometimes. Luckily, I haven't choked to the point where my breathing was blocked out. That's never happened. But the Seroquel definitely causes difficulty in my esophagus. Every once in a while, they have to dilate my esophagus so that doesn't happen. I have to talk to my gastroenterologist about doing that procedure again. But, anyways, my auditory hallucinations are very intense today. I feel very angry. I'm not suicidal, I'm not violent, but I feel very agitated, paranoid, delusional, thinking people are following me, spying on me, laughing at me, trying to harm me. Um, my depression is very severe. My energy levels are very low. I just generally feel like crap today. I am seeing my therapist tomorrow, so I'll be talking to her about a lot of this stuff. And I did get a new therapist. This will be the second or third time I'm seeing her. My therapist was abruptly changed a few weeks ago without much warning. I was kind of pissed off about that fact. They could have gave me a bigger heads up, but it is what it is. It is difficult to change therapists, but it's even more difficult to change mental health clinics because in order to get into a mental health clinic, you have to wait 3 or 4 months before they even assign you to somebody, and even longer before they assign you to a psychiatrist. So I'm staying at the clinic that I'm at. I still have the same psychiatrist. I still have the same peer support specialist. Um, Generally, I'm doing physically okay, I guess. I came back home from the hospital yesterday. I'm a little nervous and agitated. That's probably why I'm so agitated today, because of what happened yesterday, by going to the emergency room. I didn't want to have to go to the emergency room, but the food was stuck in my esophagus for about 2 hours. Normally, when that happens, the food gets stuck. It usually goes down in 20 or 30 minutes, and this time it just wasn't going down at all on its own. So I decided to go to the emergency room just to get it over with. But eventually it did go down on its own. They didn't actually have to do anything at the emergency room to force the food to go down or come back up. Um, so I guess I'm lucky in that regard. They did make sure to tell me that I need to chew my food more properly because that's part of the problem too. I tend to eat too fast and then I get large pieces of food stuck in my esophagus, right about my sternum, right where the heart is near the lungs, but below the lungs where I can still breathe. But um, yeah, so I'm seeing my therapist tomorrow, and I'll be discussing all this stuff with her tomorrow. And I just want to wish my friend Sue real well because she's going into surgery January 19th on her back, which is 3 days away. Today is the 16th. I just talked to her over Facebook a couple hours ago, and she had to pick up a back brace to prepare for her back surgery. And I wish her well. I hope she does okay. And that's pretty much all to report on right now. Like, comment, share, subscribe.